like I say, many organizations have shared goals for climate action, but we have different methods and specific actions towards getting to those goals. Ideally, those specific actions should complement each other, but sometimes they conflict. So today, we're very privileged to have 3 leaders from several organizations that are working in the same area to talk with us about both what their organizations are doing and ways we can work together, and also potential areas of conflict. Dr. Natasha DeJarnett is the Research Director or Research Coordinator for the National Environmental Health Association. Lyndsay Alexander is Assistant Vice President, the American Lung Association, and Director of the Clean Air Program. And Dr. Mona Sarfaty is Director of the Medical Society Consortium for Climate and Health. So what we'll do is each will present for about 10 or 15 minutes. If you have questions, please write them down on one of the index cards that are included in your packet, and we'll pick those up and have time for question and answers at the end. And we'll start with Dr. Sarfaty.
Thank you very much. We had a little sidebar conversation, and we're actually going to make a switch, and we're going to start with clean air. So Lyndsay Alexander is going to lead off.
Is this on? Okay, so while we're waiting to get slides working, I thought I could get started since we do want to keep everyone on schedule and on time. So my name is Lyndsay Alexander. As you heard, I'm Assistant Vice President and Director of the American Lung Association's Healthy Air Campaign. I want to thank you for the opportunity to be here, and I want to commend all of you for your passion for addressing climate change and your commitment to making our decision makers pay attention to this as an urgent need. So I want to thank you, all of you, for being here. Addressing climate change is a critical part of the American Lung Association's strategic imperative. Our core vision is a world free of lung disease, and our mission is to save lives by improving lung health and preventing lung disease. That's what we're about. We have a strategic imperative specifically to improve the air that we breathe so that it does not cause or worsen lung disease. And I tell you that because that's the umbrella under which we do our climate change work, is to improve the air we breathe so it doesn't cause or worsen lung disease. And that's an important framing issue. This is because the evidence is very clear that climate change is an urgent threat to our health, and in particular, it is degrading the quality of the air that we breathe. We have an annual State of the Air report, comes out every year. One of the things that was very, very clear in this year's State of the Air report is the way in which changing weather patterns, warmer temperatures, are really changing our ability to succeed in the fight against air pollution. It's making it more difficult to make progress reducing particle pollution when we have wildfires burning and the smoke plumes going hundreds of miles. It is making it more difficult to reduce ozone levels in communities across our country when we have rising temperatures, because temperature is a key component of smog formation. It's not the only one. We can continue to make progress reducing a lot of the precursors to ozone. But what we saw in this year's State of the Air report was an unmistakable fingerprint of climate change. And that is not good for health. Ozone and particle pollution are two pollutants that are two of the most widespread pollutants. They are linked to premature death, to asthma attacks, cardiovascular harm. They are linked to reproductive harm. Particulate pollution is actually also linked to lung cancer. So the host of negative impacts from ozone and PM as just two examples of the way climate change connects to our health through temperatures and weather patterns. And feel free to come up if you want to come mess with the slides. Don't be shy. I would love to be able to show some of the slides that I have. So, excuse me. The thing about air pollution is everyone is at risk, even healthy adults. But not everyone is at risk equally. Some people are more at risk. Children, Their lungs are still developing, and pound for pound, they breathe more air. Older adults are also more at risk to the negative impacts of air pollution. People with chronic disease, lung disease, heart disease, are at greater risk. And what we see in the evidence is that people living in low-income communities and in near polluting sources, and that includes some communities of color, are also at increased risks because of air pollution. And climate change, again, is making it harder to make progress in that fight. So everyone's at risk, and climate change is bad for health because it can worsen pollution levels in the air that we breathe. And I'll just point out, because my colleague Mona let me know that she isn't going to spend a lot of time talking about other health impacts of climate change, but there are many, many other health endpoints that we can make, from increasing spread of vector-borne diseases, the health impacts in the aftermath of disasters that can range from not having access to your medicines or your doctor, to, for a lung health perspective, mold that is left behind in the aftermath of floods. There are many, many reasons why, and we'll talk more about this, but the Lung Association has led an effort with many other health and medical organizations to declare climate change a health emergency. And we mean that, and we document and we outline what that means and what are those health endpoints and what needs to be done about it. And I'll show you some of the other organizations that we're partnering with around this. But because our focus is on air pollution, I want to put in a little bit of perspective, and this is where the slides are super helpful. Yes, this is me, hooray! Thank you. And I might just keep using this because then I can move around a little bit and you all can hear me and I won't be stuck with that one. Here are some of the other health impacts. I'm focused here on air quality impacts. This is a slide that illustrates some of those endpoints related to ozone and PM exposure. This slide illustrates who's at risk, and the truth is it's all of us from air pollution. So putting in perspective this threat to our air quality, it has to be done in the context of the tremendous success here in the United States that we've had in reducing air pollution. Since the Clean Air Act was implemented, since it was adopted in 1970, updated in 1990, and as it has slowly, with a lot of fights, been implemented over the last several decades. It's very effective. You can see our skies are cleaner. But I also want you to understand the health benefits that we experience because of the Clean Air Act and because of cleaner air. That includes, just for example, 230,000 premature deaths that are not experienced every year in the United States, that are avoided every year in the United States. And this is a low bar, and it doesn't include a decade worth of rules that have been put in place and pollution safeguards that have been put in place since this study was completed in 2010, and they'll do another one in 2020 if, well, you know, they're supposed to do another one in 2020. You can see 200,000 heart attacks avoided, 2.4 million asthma attacks avoided. The Clean Air Act works. It's a highly effective tool at driving pollution reduction. It is not good news that climate change is making it more difficult, but it's important to understand the perspective that it works. And the last point that I will make is we hear repeatedly from polluters who don't want to take the steps to reduce their pollution as required by EPA and by the Clean Air Act, that it's going to destroy the economy. And in decades of progress reducing air pollution, if you just look at the 6 common pollutants that are aggregated there, they've come down 67%, while GDP has gone up 158%. This is the 2016 report. The numbers are a little bit different over the last couple of years. But we can't buy their arguments. We can't buy the sky is falling, it's going to cost too much, it's going to hurt our economy. There is not a shred of evidence to support that. So I mentioned the Declaration on Climate Change and Health that says climate change is a health emergency. It is signed by the American Academy of Pediatrics, American College of Physicians, the American Lung Association, APHA, National Medical Association, National Environmental Health Association. A lot of very respected organizations are coming together to highlight the concerns that we have about the impacts of climate change on health. Health professionals, we have a similar declaration for doctors and nurses and other clinicians we have thousands of people who have signed this. It says, we know that the health of every American is threatened by climate change. We are working to engage policymakers, much like you are. We are in their offices, we are in their news feed, we are in the media coverage that they are reading. And we are working to try to create a safe space for politicians to do the right thing when it comes to climate change and to do it for the right reasons and to support the policies that will most protect health. So it's what they do, it's why they do it, and what is the outcome that results from their activity with respect to human health. We're working to highlight the consequences of both air pollution and climate change. For us, it's the same fight. You can see how they're intricately tied together for us. So it's in our news coverage, it's in how we frame the issue and try to drive the decisions home with decision makers. One of the things that we did this year to try to tie it all together in an even bigger way is declare 2019 the year of air pollution and health with a monthly focus on air pollution, equity, health, and climate change. So trying to tie it all together, we've got partners, national, state, and local level, and health and medical organizations who are working with us. The theme this month is impacts to moms and kids. Next month, we're looking at heat and and ozone pollution, because that's when we really start to see those elevated ozone alert days. And then after that, we're going to focus in August on air pollution from wildfires and health impacts of extreme storms. And this is where we come together around messaging, educational events, congressional briefings, social media. It's a variety of things. We did a film screening in February to talk about who bears the burden of air pollution. This is the higher level public engagement kind of educational work that we're doing, even as we fight a lot of policy fights to defend clean air protections against the current administration's actions and to advance future protection and to lay the groundwork for action on climate change in Congress from a health perspective. And we tell the story in the most compelling ways that we can. I'll introduce you here briefly to Laura Kellogg, who's the mother of 3 children with severe asthma. She moved from a highly polluted community in Massachusetts because her kids were spending 30 days a year with the school nurse instead of with their friends and in their classes and out in recess. And she finally went to her doctor, and he said, well, you could consider moving someplace else that has cleaner air quality. And she took him up on it. Her family moved to Wilmington, North Carolina, which is one of the cleanest cities. But has anybody watched the news the last few years? What happened to Wilmington? Immense storming and flooding, and it is a coastal city that is vulnerable to climate change. So you can't really escape this. I'll say from an air quality perspective, her kids were thriving. One of them played saxophone at Carnegie Hall. The other got a full scholarship to the University of North Carolina. These kids are doing so much better playing baseball because they can breathe. And when we're trying to frame up an issue, this was in defense of the Clean Power Plan limits on carbon pollution. So this was in defense of Obama's climate reg put in place by EPA. Laura was saying, this matters because my kids can breathe better if we clean up pollution in the air and if we address climate change. So we try to mobilize the health messenger, not just from doctors and nurses' perspectives, but from people, real people that we can all relate to. And the last thing we're doing is trying to draw a circle of protection with our health and medical allies around the Clean Air Act. And the reason this is so important is that I mentioned how industry fights tooth and nail every single Clean Air Act reg that is proposed to be put in place. And they have astronomical claims of economic impact and devastation that will result. They have a long list of legislative proposals that they are looking to try to implement to any moving vehicle. And over the last decade, we have defeated hundreds of attacks on the Clean Air Act in the legislative process, either because they didn't move or because they were actually voted down. But it is relentless, the list of things they'd like to weaken the Clean Air Act. And when we think about climate legislation and what's coming, that is just one more moving vehicle that they're going to attach, if they can, efforts to block, weaken, or delay the Clean Air Act. And so as health and medical community leaders, we are saying no. The Clean Air Act is not up for negotiation. It's not a tool that you can barter with because people's lives are at stake. So when it comes to those current legislative threats, we're so excited, like many of you, and in part a result of your pressure, we are seeing more proposals in Congress to address climate change, and that is a good thing. Those debates, those conversations around policy are a sign of progress, and they are a sign of the constituent pressure that many, like yourselves, are putting on people in Washington, decision makers in Washington. And it ranges from putting a price on carbon to investing in renewable energy and energy efficiency, cleaner vehicles, et cetera. All good things. There's even specific legislation to invest in health adaptation. And there are some climate solutions that industry has been effective in inserting some of their dangerous provisions into. And I want to flag them for you. This is more in the category of challenges and areas of conflict for us to be aware of and to work through and to know what's at stake and to work together to protect our health. I'll talk first about one of the most egregious examples, which is not yet in legislative text, but the Climate Leadership Council, otherwise you may know it as the Baker-Schultz plan, includes some pretty dicey provisions, but they make perfect sense if you're a big polluter. Shielding Shell, Exxon, Mobil, and BP from climate liability, so liability for the emissions that they've been pumping into our atmosphere for decades. Thank you. Another provision, they entirely repeal EPA's authority under the Clean Air Act to address greenhouse gas emissions, which was affirmed by the Supreme Court. This means that we would not have the cleaner car standards that are on the books. It means EPA would not be able to limit carbon pollution from power plants, which is in litigation, but EPA proposed and finalized under Obama and would reduce carbon emissions more than 30% from the power sector. The Clean Air Act is not only a public health tool, but it has a lot of authority that can be leveraged against the climate fight. But only if we defend it, and only if EPA keeps that authority, and it is the only reason many of the polluters are coming to the table. Because it's the hammer right now. It's what we have. I want to mention specifically the Energy Innovation and Carbon Dividend Act, because it too shows the sign of the interests of polluters and an imprint. It isn't the same as the Baker-Schultz Act. It is not shielding liability, but there's a provision that would remove EPA authority for a decade. Does anybody know how much time the IPCC said we have left to act? So if we give up EPA's authority for that amount of time, we don't think we should give it up. But if you care about climate change, thinking about, oh, it's just a pause, it's just a regulatory pause, but it's a pause for 10 years, in the 10 most crucial years we have left to act. And so I flag that for you. The other side is always going to ask, what can we get out of the deal? And what do we get out of this deal? What do climate advocates get out of this deal? One Republican. My question is, what's the price we have to pay for a truly bipartisan solution when it comes to the Clean Air Act? And I can tell you from being in the belly of the beast, the list of ways they want to gut the Clean Air Act is long, and it's dirty, and it's dangerous. We've got to stand up against that. So we know the Clean Air Act is an essential tool. I'll leave you with this, the sort of adage of the nose under the camel's tent. If the nose is there, the rest of the camel will soon follow. So keep that in mind. And the last thing I will share with you the link to the call to action. But what I want you to know is that our Declaration on Climate Change and Health, all of these organizations that you see here, agree with the American Lung Association that the Clean Air Act has to be held sacrosanct. And here we've got 4 principles. We want science-based targets. We want to maximize benefits to health. We want to clean up pollution in all communities, and this is especially important for environmental justice impacts. And the last one is that we want to leave the Clean Air Act fully in place in any policy that would address climate change. And that's why the Lung Association is unable to support the current bill, because it contains that provision. But we understand that there may be a Senate version that does not include this provision. We would highly argue that that is a far better, superior bill, but we haven't seen the text, so I can't tell you if we'll end up supporting it or not. But we are not alone, and I think that we can leverage your passion and power and our credibility and passion and power as health and medical orgs to win a solution on climate change that doesn't put us at a disadvantage when it comes to air quality and the Clean Air Act. Thank you.
All right, it looks like we have overcome the technical difficulties. And so I want to thank the CCL Health Group for inviting me to speak this year. I've spoken here before. This is definitely one of the most exciting meetings that happens in Washington every year. There's more people that come into town to visit their own representatives than I think any other meeting brings to town. And so the fact that everybody is here to visit their legislator it's really exciting, and that's an opportunity that we have as citizens that obviously not everybody in the world has, and it's terrific to see so many people taking advantage of it. So now that the subject of climate change and health has been introduced, I want to talk some about our organization and what our organization is doing along with other organizations to address climate change. So I represent something called the Medical Society Consortium for Climate and Health, and we're a relatively young group. We've been around only for several years. We've been expanding rapidly. And I want to tell you a little bit about where we've been and where we're looking forward to going in the future. So first of all, our mission is to inform the public and policymakers about the health harms of climate change and the health benefits of climate solutions, and also about the variety of preventive and protective measures that we can take as we look to the oncoming scourge of climate change. We support actions by physicians and hospitals, specifically in their workplaces, to adopt sustainable practices. And we recognize the importance of health professionals' involvement in policymaking at the local, state, national, and global level. And I wonder if I can just ask for a show of hands of how many people here identify as health professionals? Okay, so most of you do. That's wonderful. And everybody else is just as welcome if you don't. Glad that you're here. Okay, so I think I'm going in the wrong direction here.
Use the down button.
There, okay. All right, so for the consortium, this last year has been a great year of growth, action, increased visibility. We have had a lot of the societies that are members of our coalition increase their own internal commitments and their communications. We've added a lot of affiliated organizations. We've banded together to roll back the EPA, to stop EPA rollbacks, which have been coming, pretty regularly since the new administration took responsibility. And we've also working to support activities at the state level where a lot of progress can still be made. With regard to going forward in 2019, want to tell you all to look toward June 24th, which is not that far away, because we're going to be announcing a policy agenda, which we feel is an agenda that can address the emergency represented by climate change, and which has a number of components. Some of the components are things that we can do that will address our health, will improve our health, and will also help the climate. And other things are things that we can do that will address climate change and also benefit our health. This agenda is already supported by 60 organizations, and you can go to our website on the 24th to see the agenda when it's published, and you may also see evidence of it in some of the mainstream media, television, or newspapers, or you can sign up for our newsletter and receive it. So this is all occurring against changing public opinion, and I want to show you a graph which is very interesting because this shows that about half of Americans think people in the U.S. are being harmed right now by climate change. That's the best that it's been in the last 10 years. But it's still really a pretty, meager showing compared to the reality, which is that people all over the country are being harmed right now because of climate change, whether it's because of heat or flooding or storms or the fires that are coming because of drought, or because of the deteriorating air quality, or the increase in allergic reactions because of the greater, faster growth of trees and other pollen-producing plants. There are many, many sources of these health harms, and all over the country, people are being impacted by it. And we started when we surveyed physicians around the country and found out that about half of them felt they were seeing patients in their own offices who were impacted by climate change, who had health harms because of climate change, to either a moderate or a severe degree, and about another 20% they felt were being impacted by climate change to at least a modest degree. So 70% overall thought they were seeing people in their own offices who were impacted by climate change. That was pretty impressive. And as a result of that, many organizations came forward and said that they would be happy to coordinate to try to address the problem. And that's really what gave us our start. So I don't know if you've heard of Global Warming 6 Americas or not, but we're based at the Center for Climate Change Communication at George Mason University. And that center, along with a similar center at Yale, has been studying public opinion for the last 10 years. And based on what they've learned, they've segmented the American population into 6 different groups, and you can see them here. So at one end of the spectrum, you have people who are alarmed and concerned about climate change, and at the other end, you have people who are doubtful that it's happening or who are completely dismissive that it's happening at all. And those numbers have evolved over the years, but right now we have more people in the alarmed and the concerned category. It amounts to 59%. Than we've had in those 2 categories than ever before. And we have fewer people in the doubtful and dismissive end. It's now 18% for those 2 categories combined, and that's a smaller number than it's been over the last 10 years. So public opinion is truly shifting, and that opens the door to some movement on policy, which we greatly need if we're going to be able to make progress in addressing climate change. Okay, so our core strategies are to organize health professionals, to empower them by providing information and materials, PowerPoint presentations, the kind of education, training and communication, et cetera, and then to amplify the messages by newsletters, by writing op-eds, by bringing together people in meetings, by forming smaller organizations at the state level, by trying to multiply the number of people who are involved as quickly as we can. So with regard to organize, we're currently 23 major medical societies, and we represent about 60% of all the doctors in the United States. We have 32 affiliates that represent another 1.5 million people, and include some very well-known ones like the American Lung Association and the American Heart Association and the American Public Health Association and the National Environmental Health Association, and Healthcare Without Harm, which represents hospitals. Our funding has been increasing pretty steadily, and we're now providing support directly for several state-based associations. We call them Clinician Climate Action Groups, and there's one in Virginia, another one in Florida, one in Missouri, there's another one in Ohio, and then there are other groups with different names, but basically the same idea in a whole variety of other states. Okay, we have a number of the societies that are part of our group, and some of you may belong to these societies, have established their own internal member interest groups. So if you're a family physician, there's now an internal member interest group in the Academy of Family Physicians. There is an internal interest group in the Organization of Obstetrician and Gynecologists, and also in the psychiatry group. And so there are ways that you can affiliate with people who are in similar disciplines to yours, come together, think about how climate change impacts the people that you take care of, and how you can use that association to be able to get more people involved in addressing climate change. We are affiliated with Healthcare Without Harm, which organizes within hospitals. And so we're very much interested in how energy is used, the kind of transportation that is supported, the waste generated, and also food services in hospitals. And there's also an outpatient version of that called Practice Green Health, which focuses on office practice and how office practices can be greener. And quick formation of a committee composed of just a few people in an office can, with regular meetings, make major differences and save money and make offices greener. And so there's a whole website devoted to that. If you're interested, you can access that information as well. Here's some examples of hospitals that are making progress. Aurora Health System in Illinois is going to 100% renewable energy by 2030. Kaiser Permanente has made a commitment to be completely carbon neutral by 2020. Dignity Health, which is a health system in California and in the southwestern part of the United States, is trying to reach zero carbon transportation in all of the various forms of transportation that they use. You've got Health Partners in Minnesota, which is reducing waste, and many of you probably know that hospitals are very wasteful. We generate about 30 pounds of waste for every person who is admitted to a hospital each day. And so there's tremendous opportunity for improvement there. And then I mentioned mygreendoctor.org, which will help you walk through greening your office practice or come together with others to green your outpatient facility. I mentioned empowerment. We had a major open annual meeting in 2018. We had another meeting this year. We're bringing together health professionals to try to get additional education, acquire materials, practice communicating, and to figure out what we need to do to be more effective advocates. Some of this is associated with CME, which is always of interest. We're going to annual meetings of medical societies, and at those meetings we have pledges that people can take and hold, and we take pictures, and then they get posted on social media. And so I've got a couple of examples of that here. This is a staff person from the American Academy of Pediatrics, and she's holding a plan to advocate on climate change. Here's two others, also at the pediatric meeting. One is saying that he supports meatless Mondays. The other one says, I support public transportation, and she's making a pledge to composting. Here's several people at a meeting of that was at the time of the United Nations General Assembly meeting, and one says advocate, another is composting, and another one says carbon fee and dividend policy. So we had about 40,000 visits to our website last year, and those have been growing each year. We have a newsletter with a lot of shared content. We let you know when your colleagues have written op-ed pieces or are interviewed by the media. We have a champion of the month every month, and so you can read about what various colleagues are doing as they pursue solutions to climate change. And I want to mention also that we've been funded by the Kellogg Foundation, and they have a pretty active campaign to try to improve racial equity. And so our largest single member, which is the American College of Physicians, the group of internists, is embarked in a year-long activity along with the consortium to try to improve racial equity in their organization. Our individual member societies are trying to educate their own members and get them more involved, and so the allergists had an international meeting last year, and you see the advertisement for it here. Actually, it was in March of 2018, Global Environmental Change and Respiratory Health. And so that focused heavily on some of the kinds of issues that Lyndsay Alexander was just raising about air quality. And of course, for them, this really comes down to allergies and the extent to which people are being impacted to a greater extent by allergies and what they can do about it. They had 16 sessions focused on climate change at their annual meeting. Family Medicine Organization has a member interest group, has created 2 new web pages. and is working climate change-related issues into some of the advocacy that they're doing, and so there's a lot of opportunity to contribute there to their efforts. The American Psychiatric Association is now publishing a monthly update on climate change. They have 13 sessions that are going to be offered at the American Psychiatric Association meeting this year, and they have voted to divest from fossil fuels. The American Medical Association, which is a member of ours, has also voted to divest from fossil fuels. This pie graph is symbolizes the log that we're keeping of the activities that health professionals are doing as they become active on climate and health. And so some are making presentations, they're visiting policymakers, they're writing op-eds or giving media interviews, and we ask them all to log into our site and let us know what you all are doing. And then we create this graph each year and show everybody exactly what we have accomplished in the prior year. This is our website, and that's a report that came out a couple of years ago. It's a summary of all the health impacts of climate change. It's beautifully illustrated, very easy to understand, can be understood, I would say, by a teenager or by a professional. And I would, greatly recommend it. You can download it. You can also write to us, and we'd be happy to send you a copy. And there is a slide set that goes along with it. So if you'd like to give a presentation in your community or to your colleagues, you can use that slide set, and it's all evidence-based, very complete, and also has wonderful pictures and some good stories of how physicians have been involved. So we've been amplifying our message as well, and have been mentioned in hundreds of media stories, have written many op-eds. We have record of, I think it's 14 as of 2000, as of this year to date. We've been speaking at all the EPA hearings to prevent the kind of rollbacks that will only lead to worse air quality and which are important to everybody. We're building our state footprint. I mentioned all the states that now have state-based organizations, and so we're funding several of them, but we're in touch with all of them. And there is a new one forming in New Jersey and another one forming in Wisconsin. And of course, there are many issues at the state level because federal policy is so stuck with the current administration. A lot of the policy that we can make is at the state level. We have to keep working at the federal level, and great that you all are here and are having those conversations, but a lot of progress at the state level is possible as well. And there are efforts, anti-competitive efforts, to stop the growth of clean energy at the state level. And so that's one area which greatly needs attention. Just educating state legislators about the health impact of climate change is really important. You are trusted health voices. When you go to your state legislature, they will listen. And especially if you can speak to them about what's going on in your state, it's highly relevant, and they will definitely want to hear from you. Okay, and so I mentioned we're forming more clinician climate action groups. I want to mention also North Carolina, since it came up before. There's a group called Medical Advocates for Healthy Air in North Carolina. It has 700 health professionals, and North Carolina has a Clean Smokestacks Act, which has very rapidly helped that state to reduce its reliance on coal. They've closed many, many coal plants in that state over the last 10, 15 years and greatly improved the quality of the air. And so that's a place where people might not have thought that you had the kind of progress that we are seeing at the state level. And I think is an example of what a committed group of activists can do when they work together and build coalitions. Okay, so we're optimistic that the consortium can help members and the public better understand the implications of climate change and turn that into to pressure on policymakers so that we make progress. And I welcome you to join us. You can find us at ms2ch.org. That's ms2ch.org. And if you sign up on our website, you can get the newsletter and you can log in activities that you do so you can help let everybody else know how you're contributing to the activity that health professionals are doing to get solutions to climate change. And I want to end again by letting you know that on June 24th, there's going to be released a policy action agenda, which will essentially be an agenda that all health professionals can support. It has all the things that we can do about climate change that benefit health, and all the things that we can do within the health sector that benefit climate change. So thank you again, and now turn it over to the next speaker.
Famous last words. I just told Rob, I said, okay, I got it. Oh, now how do I make that go? Never mind. Wonderful, thank you. Thank you so much to the Health Action Team for the kind invitation to join you this afternoon. It is so tough to follow Lyndsay and Dr. Sarfaty, but I'm honored for this great opportunity. And I imagine we have a stack of questions, so I want to try to get out of your way as quickly as possible so we can get to a little bit of Q&A. I work for the National Environmental Health Association, and I want to share with you some of the work that National Environmental Health Association is doing as it relates to climate and health policy. But first, I want to just give you a snapshot of our organization. We exist to advance the environmental health professional with the purpose of providing healthful environments for all. So we strive to empower and educate and train the environmental health professionals so that they can protect us and our communities, to keep our water safe, to keep our air quality clean and healthy, and to make sure that we have safe environments all around us. We have about 6,000 members, and our staff works to provide training and resources to equip the environmental health workforce. We're unique in value in that we're the only national organization that is solely devoted to the environmental health profession and the environmental health professionals. We also work to advance science through our Journal of Environmental Health, which reaches over 2,000 readers. We also have a dynamic and growing membership. Our membership has grown 40% since 2015. And this is unusual in the space of membership organizations, but largely, our membership is the environmental health workforce. They are generally state and local environmental health employees, but we also have environmental health professionals that work in academic research, for example. And we are the voice of environmental health on the Hill. And I'm going to break the talk into what we're doing as it pertains to climate policy, and then what we're doing as it pertains to informing climate policy. So in terms of our government affairs work, what we advocate for is the environmental health professional, is the field of environmental health. As a consequence, there are a lot of positive outcomes that have come that have implications on climate and health activity. For example, we have helped to secure the Pandemic and All Hazard Preparedness Act, which is now, I believe, at the President's desk. We also have advocated and helped to secure funding for Zika research. We have helped to secure funding for CDC's National Center for Environmental Health, thereby for CDC's Climate and Health Program, which has been funded at, I believe, $10 million since our inception of our government affairs program. It's projected that that could increase this year. Everyone keep fingers crossed. And then we've also helped secure funding for CDC's Hurricane Recovery Program. And this has allowed us to do work in U.S. Virgin Islands struck by Hurricane Maria and equip environmental health professionals there to protect communities. We have, and the bulk of the rest of my presentation is sharing the work that we're doing to inform policy. So we're providing support to communities across the U.S. to work on climate and health adaptation. So we had many grants that we were able to provide to the Minnesota Department of Health and a tri-county region, including Clackamas County Health and Human Services in Oregon. And this allowed them to do mapping and assess the vulnerability of their communities to climate change. We also are working to inform policy by advancing research. Through our work with Eco America, we've surveyed our members to better understand their perceptions on climate change for the last 3 years, and we published this in our Journal of Environmental Health, a summation of those last 3 years of research. Okay, here we go. I'm joking. There we go. So also for informing policy, we're working to provide educational resources to equip our members. So we have a report that's coming out very soon, any day now, on emergency preparedness and response that's assessing the environmental health professionals' role in addressing climate change. And then in addition, we have our annual educational conference, which takes place each year. It's full of sessions that provide the latest in practice and policy as it pertains to climate and health. So we have two things that I wanted to share with you about our AEC this year. We have a climate and ambassador training workshop. This is the second year we're doing this. This is also through our partnership with Eco America. And then we also have a full day of climate and health sessions from start to finish, each educational session taking place that day. At each educational time point during the day, there are climate and health sessions. So we're really excited to be able to share that with our members and attendees at our upcoming annual educational conference, which you can see is rapidly approaching. In addition, we're working to shift the narrative. So we're exploring other means of communication, including video. We created a video also with our support from Eco America that actually we filmed at our annual educational conference last year. That's available on our website, neha.org. And we also are contributing many blog posts. At least bi-monthly, we're contributing blog posts to our own NEHA Day in the Life blog site and blog sites external to us. We're also working to walk the talk. We have policy statements on climate and health. We have a current statement on climate change, which is sunsetting this year. So we're in the process of updating our current climate change policy statement, and we are drafting a renewable energy policy statement that will this year be submitted to our board of directors for full review. In addition, we walk the talk by changing our internal practices. So we're not just saying to our membership, hey, protect our communities. We also have to walk the talk and do our responsibility as it pertains to climate change. So we have committed to 100% clean energy by 2030. And we were among several awardees at Eco America's American Climate Leadership Summit to receive an award for this, including Physicians for Social Responsibility, the Alliance of Nurses for Healthy Environments, as well as the American Public Health Association. So lastly, I'll just share with you some of the partnerships that we have in the space of climate and health. We're currently funded through the CDC Climate and Health Program. We also have had partnerships with Eco America's Climate for Health program. We are part of the Leadership Circle. We are part of American Lung Association's Healthy Air Partners. I am on the steering committee for the International Transformational Resilience Coalition. We are an affiliate, as Mona shared, of the Medical Society Consortium on Climate and Health. We're part of the U.S. Climate and Health Alliance, and then we're also proud to be a partner of the American Lung Association's Year of Air Pollution and Health. And we've signed on to recent sign-on letters. All of these have been discussed by both Mona and Lyndsay, including the U.S. Call to Action on Climate, Health, and Equity, which that release of the policy action agenda is expected June 24th. The Health Professionals Declaration on Climate and Health that's led by the American Lung Association, and also the Global Call to Action on Climate and Health that took place last year. So with that, the National Environmental Health Association, if you need connection to any environmental health professionals in your area, we're happy to help make those connections for you. environmental health professionals are uniquely positioned to be able to address climate and health because we have the expertise. There's no area, I can't come up with an area of environmental health that is not touched by climate change. So we have the expertise. We work on air quality and water quality and vector control, all areas affected by climate change. But in addition to that, we work locally. Many of our members are local or state employees, and climate change is inherently local. Our executive director, Dr. David Dijak, says that often, and we all can speak to it. Each of the regions that we represent can say that we're experiencing wildfires or we're experiencing flooding. So the National Environmental Health Association is happy to connect you with our members across the U.S., and we ourselves want to make sure that we are at the table to voice the concerns of the environmental health workforce and offer the workforce as a powerful solution in addressing climate change and health. Thank you so much for your time, and we're happy to begin the question and answer session.
Well, thank you to all of our speakers and also for being so flexible with audiovisual. Let's go straight to our questions. We have quite a few, and we won't get to all of these, but I will point out to at least the CCLers here that a lot of these we can answer through the health forum from the health team and others. So actually we will post these later, not today, but later in the week with some discussion around those. But one and this is for Lyndsay, would the Lung Association support the Energy Innovation Act if language weakening the Clean Air Act was eliminated? And the comment follows that the Clean Power Plan would no longer be needed if we put a price on carbon. So,
I can tell you that we can't support it while it includes that language. It would have to go through our internal legislative review, and we haven't put it through other than to flag the concerning language in the bill. So I will have to get back to you on that if we see a version introduced without the concerning language on the Clean Air Act. Is there, and then on, I don't know, do you want me to go into the second part of that question?
I'm sure if you want to comment on it, that would be fine.
I think in terms of, so there are many, many considerations with what does it mean that the Clean Power Plan wouldn't be needed. I think there are a lot of people who would argue that putting a price on carbon is part of a solution, but it is not all of the solution. But what I want to say is that it's not just EPA's authority on carbon and putting a pause on that is of concern. Again, going back to the metaphor of the nose under the camel's tent, that makes every other attack on the Clean Air Act germane as that legislation moves forward. And it is a big red warning sign for all of the other authorities existing under the Clean Air Act.
Thank you. And another one for Lyndsay. Would legislation that makes CO2 regulation clear in statute rather than court interpretation of the Clean Air Act be attractive?
We don't want to open the Clean Air Act up, period. It's not attractive because of the politics have shifted around that, and we trust the interpretation of the Supreme Court. I mean, I think that's why it exists. Laws are written, they are often considered vague, and they have to be interpreted. What would keep the next law from also needing similar interpretation?
Okay, thank you. Okay, and according to Rick Knight from CCL Energy Innovation and Carbon Dividend, does not pause the Clean Air Act, and it includes a provision for the first time that EPA is mandated to get the air cleaner according to standards stated in the bill. Who have you talked with that supports the ALA interpretation of the bill? I guess is the question.
Well, thanks for the question. It's not our interpretation. The Congressional Research Service, which is a service that provides legislative summaries for congressional staff, their interpretation of the bill is that it pauses Clean Air Act authority, and so it's not our interpretation, but I have had conversations with the head of government affairs at CCL about our concerns, and also with the executive director just recently, Mark Reynolds, to talk through our concerns, particularly with where the legislation, where it goes from here as it moves through the sausage-making process that is legislative policy development in Washington, D.C.
Again, we've unfortunately run out of time, but let's thank all of our speakers up here for a wonderful session.